All right, I had a doctor's appointment. So actually, it was my crazy doctor appointment. So I was at therapy. So I didn't get a chance to do chicken chores today. Chris did them. So we're just going to go say goodnight to the girls and everybody, and that'll be it. So you're not going to get a whole lot of animal time tonight, but it's okay. What are you doing? They all give you the side eye. Chickens are great for the side eye. Mainly because their eyes are on the sides of their heads. All the duckies just freeze. Look, and I can't get this stupid thing. There we go. I don't know why they do that. I guess it's like a defense thing. Come on, girls, you have to get inside. Look, they're on. Look, there's hardly anybody in here. Come on. Come on, get in. Oh, Tallulah, not you. You can't get in. Hello, baby. Hello. Hello. Hello, kitty cat. Do you see this? See this nonsense? Look, she's thought better of that. She knows. Don't chase chickens. Don't chase chickens. Oh, look, everybody's over here too. Hi, guys. Oh, Lula. You're cold. Look, what do you have in your fur? Here. I don't know why you guys don't want to come out. You've been hams the last couple days. All right, mommy's cold. She's going in. Hi, guys. So I realized that over the last couple days, we've actually talked about ways to prevent getting sick. Well, kind of like with the fermented foods and the gut health and making bone broth. And it's the middle of cold and flu season, so I thought, you know what? Maybe I will do a talk that I have done before about when to take your kids to the doctor. So as a PA, working in pediatrics, Jesus, oh my God, I just looked up on my shelf and the elf on the shelf is staring at me. It's Marco Navidad. Obviously, as a PA, like I avoid the doctor like the plague. And you know why? Because you can get the plague there. Maybe not the real plague, but I think that the stomach virus is like the plague. I mean, there's nothing like cleaning up somebody else's vomit or diarrhea. Really gross. So we're going to talk about avoiding the plague today. So everybody, lots of new parents and some parents with lots of kids. I hope nobody gets offended by this, because if you are one of those parents, everybody is trying to do their best. Everybody is trying to do their best at raising their kids and taking care of their kids and keeping their kids happy and healthy, okay? So don't take offense. I know today, like, Everybody takes offense over everything. Like, I was sitting at a stoplight. We literally sat through a green light, an entire green light, because I was worried about offending the lady in front of me who was on her phone, not going during the green light. I don't know. Normally, I wouldn't have even worried about it, but for some reason today I was like, oh, I really don't want to. I don't know. But anyway, so being a PA, my kids do not go to the doctor except for well checks and shots. If they're sick and it's not anything that I deem serious, then they stay home with me for a couple days and that's it. But some people, it's hard to know. Like, how do you know? Is your kid sick enough to go to the doctor? Should you take them? Is your kid, kids fake it. What's the deal? Like, what do you do? So I just want to tell everybody, as far as for me, what would warrant going to the doctor? So I'm sure everybody, if you watched the video from yesterday, my God, you saw that snotty nose of Asher's. Oh, he's so gross. Okay, so we're going to separate these, illnesses, categories into two things. Okay? So GI and upper respiratory illness. Okay, so gastrointestinal illness, upper respiratory illness. Okay, so GI. That's vomiting. I don't know why I'm rating this. Like, obviously I'm telling you. I don't know. Anyway, it's vomiting, nausea, diarrhea, bloating, upset stomach, any of those things. Like the Pepto commercial. Nausea, heartburn, indigestion, upset stomach, diarrhea. So, stomach viruses. Unless your child has been vomiting for days, don't go into the doctor. Now, obviously this does not apply to all children. All children are different. If your kid has like diabetes insipidus or some other like heart defect or some other illness, some other condition that makes it so that when they get sick, it's for real, it's serious, don't listen to any of this. This is for like run-of-the-mill kids. This is for normal kids. But vomiting, yes. Does it suck? Of course it does. I don't like cleaning up vomit. I definitely don't like cleaning up diarrhea, which thank God I don't really have to, Asher, but I wipe his butt every day. But, so if your kid gets a stomach virus, sometimes they might have a fever. Maybe they'll have a fever. If they do, give them Tylenol. For me, Tylenol's easier on the belly. Motrin, if I'm throwing up, I'm going to throw up more with Motrin. So, that's just me. But if they have a little fever, give them some Tylenol. Push fluids. Fluids. Which fluids, you ask? Pedialyte. Everybody's like, bleh, Pedialyte. Disgusting. No. Give your children Pedialyte. Do not give them Gatorade. Gatorade is full of sugar. Gatorade is going to make them have more diarrhea. Don't do it. Chicken broth is fine. Water is fine. Do not give them soda. No. Don't do it. Lots of sugar equals more poop. Okay? You're also going to keep it bland. What are things that are bland? Chicken broth. Toast. Dry cereal. Nothing fun. Nothing exciting. Nothing that tastes good. I like chicken broth, but still. But look. Things that are going to help with diarrhea. Bananas, rice, applesauce, toast. All those packed full of fiber. Oatmeal that doesn't have any flavoring in it. So like plain oatmeal. Okay? That is going to help bind them back up. You're not giving them kaopectate, which is going to block them up. And then you have another problem to deal with. Do not go get your child McDonald's. Oh, but they won't eat. So the only thing he would eat was little Johnny wanted to have chicken nuggets. You know what? Little Johnny wants to throw up then. Don't. Fatty foods, rich foods, stuff like that. If your stomach is upset, do not do it. Don't feed it to your kids. Okay? If your kid stops peeing, that is a reason to go to the doctor. Okay? Push fluids. Push, 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 push. If they are peeing, then they are fine. You don't have to run to the doctor because they're vomiting or have diarrhea. You can just keep them at home, keep them off the video games, tell them to lay down, drink their Pedialyte, and make it to the bathroom on time. But, so GI is easy. GI is simple. It's messy, but it's simple. All right, upper respiratory. This is where the majority of my patients were coming from. Upper respiratory, it's either a virus or it's bacteria. They're kids. I mean, if your kid's getting like fungal infections, then you've got more problems than just that. But anyway, so we're not even going to talk about that. We're going to talk about viruses, which are any kind of common cold, the flu, things like that. I mean, viruses are always changing, always evolving. That's why they're so terrible, and you get a million colds in a year and you still haven't gotten all of them. And then the bacterial illnesses are things like pneumonia and strep, bacterial ear infections, sinusitis, which is a sinus infection. So those are reasons why you need antibiotics. Now, does every time you have a runny nose mean you need an antibiotic? Nope. Please do not go to your doctor for a cold and expect them to give you an antibiotic, because it's not going to happen. If it does happen, they are not doing their job. Okay? We have superbugs out there and things that we cannot even treat anymore with antibiotics because, you know what? It got way easier to give the public antibiotics. Worst mistake ever. I mean, maybe the opiate thing was probably worse, but still. Viruses are not cured by antibiotics. Viruses are cured by time. That's why colds last a week or more. But antibiotic isn't going to change them. It might make you think you're feeling better, but it's not. The virus is going to get over whether you like it or not. Okay? So, your kid comes home from school. They have a runny nose and a little cough. Do you need to go to the doctor? No. Please don't. Because you will leave with something more than you came in with. Okay? Your kid has a green. Their snot is green. And their cough is wet. Do you go to the doctor? I don't know. Does your kid have a fever? No? Then no. You don't go to the doctor. You make them drink lots of fluids and, take some cold medicine. And then you send them to school. That's what you do. But seriously. So lots of parents get scared because they're like, oh my God, you hear all these terrible things. I mean, what about this RSV thing and the flu is going around and their kid's dying? Of course, look, I'm not saying that if your kid has a runny nose and a cough that they don't have the flu. What I'm saying is if your kid is fine, then you don't need to go to the doctor. So, is your child fine? Do they have a fever? What is a real fever? Great question. Great question, because it's a question that I have answered thousands of times. A fever is not 99. A fever is not 100. A fever is any temperature taken by a thermometer that is over 100.4. It doesn't matter if your child feels warm. Stop touching. I was getting ready to say stop touching your children, but your hand is not a thermometer. If I treated my kids for every time they felt warm to me, I would treat them every day. You know why? Because my hands are always cold. And they're hot kids. No. If you think your kid has a fever, take their temperature. If the thermometer says it's a normal temperature and you still think they have a fever, take your own temperature. If your temperature is normal and you feel fine, that thermometer is working. And if that thermometer is working and your kid's temperature is normal, they don't have a fever. Okay? Every kid is different. Some kids feel like absolute doo-doo at 100.8. The highest fever I've ever seen in my life, like in real life, real experience, was 106.3. That was my own kid. Charlotte actually had a fever of 106.3 one time. Got a little hairy. We did not go to the ER because I'm me and I mean, some people would probably be like, oh, that's borderline child abuse. But look, I gave her ibuprofen and Tylenol, and we took a, not a tepid shower. I mean, it was warm. It was definitely cooler than her. But, and you know what? After 20, 30 minutes, she was down to 104. We were good. We were golden. But look, that's definitely not every kid. I mean, Charlotte runs high fevers and she just doesn't even care. She's still running around. She's still acting crazy. She still eats. She still drinks. She still acts like she is perfect. Okay? I mean, half time, I don't even know when she's sick. But then there are kids. So Asher's like a normal kid. Asher, if he runs a 102, he doesn't feel very good. He's grumpy and cranky, and I have to give him medicine. And that's okay. What I'm saying is, a high fever is not 102. That's not high. A high fever is 104. You know, I mean, you definitely need to give them something. But if your kid's acting fine and they're 100.9 or they're even 101 and they're still running around acting fine, if you want to give them some fever reducer, feel free. But what is a fever doing? A fever is your body's way of killing yucky bugs. So your kid has a cold and they run a fever, guess what? Your kid's body is fighting that cold and it's going to be gone because the body is going to kill it. Your kid's running a fever and they have a bacterial illness. Yes, they have a bacterial illness. They still need antibiotics. But your kid's body is doing its job. It's when kids stop running fevers, okay, that we need to be worried. If you're not running a fever, that means your immune system isn't working right, okay? So fevers are good things. Fevers are good things. I'm not saying let your kids be uncomfortable. You still need to treat the fever if they're uncomfortable. But you don't need to be all, whoa! No. Fevers are good. Fevers are good. They're good things. So always have Motrin, which is ibuprofen, and Tylenol, which is acetaminophen. Have those on hand. During cold and flu season, have them on hand, both of them. Because if your kid does run a fever and it's a consistent fever, you need to alternate them. You need to alternate the correct dosage, one, and then 4 hours later the other one, and then 4 hours later the other one. Okay? That's exactly what they're going to do in the ER for your child. That's what you should do at home. If you do not know the correct dosage for your child, please call your pediatrician. Ask them what the last weight, if it was within a couple months, that's a good weight. If it's an older kid, even if it's within the last 6 to 12 months, it's still a good weight for your kid. To ask them to tell you the weight, and you know what? You can even ask them what the correct dosage is because they will tell you. Because they would rather tell you over the phone than have you bring your child in to get more germs from all the people who are already there spreading germs. So that's fever. Okay, so snot. Snot comes in all colors. Snot comes in clear, yellow, green, purple, gray, red. Don't be concerned about the color of the snot. Okay, I myself have had gray snot before, like actually blew it out of my nose. I was sitting at my desk at work, and I was like, oh, Pete, that's my partner. I was like, you ever seen gray snot before? She's like, ew. Do you have it? I was like, yeah, I just blew my nose. It's super gross. She's like, ew, have you been dusting or something at home? I was like, no, I think so. Of course, I didn't go to the doctor and I turned out fine. I did have a headache for a couple of days, which it was probably like a little sinus thing. But anyway, don't be overly concerned with it. You know what? If your kid has green snot, they just need to blow their nose more. I mean, it's not a thing. It's not a thing. Just because your snot is green doesn't mean you have a sinus infection. Little kids don't even have sinuses. Babies do not, you're not born with sinuses. You're not born with sinuses. They develop. Okay? Sinuses are just air cavities that make your skull lighter. That's it. Yes, they're cavities where infection can set in, but little kids aren't born with them. They're not born. So just stop. Green snot, suck it out. Aggressive suctioning, big thing. Lots of parents are really grossed out by this. But if you want, like RSV, everybody gets so scared about RSV. You know what they do for RSV? What the literature says that we should do for RSV is aggressive nasal suctioning and adequate fluids and fever control. No albuterol, no breathing treatments, No, nothing. That's all it says. Aggressive nasal suctioning. Yep. So, you can do that at home. Now, RSV can be scary. I mean, babies can die. Babies can get super sick and need to go in the hospital, right? So I'm not saying like, oh my gosh, if your kid is not breathing, don't go to the doctor. For God's sakes, people, come on. Common sense. Common sense. If your mommy sense and your common sense say something's wrong with my kid and I need to see somebody, then you go. If your kid just has a snotty nose and they're grumpy, you can probably stay at home. But aggressive nasal suctioning, always during cold and flu season, if you have a child under 2, for real, go buy yourself a bottle of saline, nasal saline, and a nose Frida. So the nose Fridas are those little blue tubes with a little hose on the end. You stick one end of the blue tube in your kid's nose, and you stick the other end of the hose in your mouth, and you suck their snot out with your mouth. There's a filter on it, guys. I mean, I know it sounds really gross, but I've done it for 2 kids, and it's totally fine. And it's super helpful. You know those little squeegee bulb things that they give you at the hospital? Well, I don't even know if they give them to you at the hospital anymore. Those things don't work. They suck. Just go buy yourself a nose Frida. They're like $10. And you change the filter and they're clean. My mom did watch me do it one time, though. I think she almost threw up. I mean, because it's like sucking an oyster out of your kid's nose. It's pretty sick. But you know what? Charlotte had RSV, and we did the nasal suctioning and fever control with her, lots of fluids, and no problems. None. But look, if your kid's having trouble breathing, you need to get somewhere. Okay? If your child is not having trouble breathing, they're eating fine, either nursing or from the bottle, suck that nose out, push that Pedialyte when they're not wanting to drink the milk, call it a day. Control that fever. Let's see. What else? So we talked about snot. Oh, coughing. Oh my God. Even my husband, okay, we've been together, I don't even know. We've been together for like 5 or so years. I don't even know. Anyway, he still asks me sometimes, like, if I think our kid's cough is in their chest. I don't know who came up with that, but no, I don't think that. I mean, a cough is a good thing. A cough is your body. See, these things are good. Fever, good thing. Cough, good thing. Yes, coughs are tiring and they're very annoying. But a cough is your body's way of getting rid of the crap that you're swallowing and you're breathing in. Okay? Same with sneezing. So if your kid is coughing, it doesn't matter if it's wet. It doesn't matter if it's dry. If your kid is coughing and it's not really bothering them, then don't worry about the cough. If your kid is coughing and they have lots of postnasal drip, it's from the postnasal drip. If you stop the postnasal drip, you'll get rid of the cough. So, best cough medicine for kids. Because kids can't have cough medicine, okay? They're not supposed to. You're not supposed to suppress cough in kids. Because then, you're stopping the body's natural disease-fighting process, okay? So don't. So Mucinex and Sudafed and Robitussin, you can use that. I think it's ages 6 and over. And I'm all for the cough medicine in the older kids. I'm totally fine with it. Actually give it to them. Like, go buy it. Don't come to the doctor and expect them to give you some kind of cough medicine, because I hate to tell you, but insurance does not pay for cough medicine anymore. Nope. So if I write you a prescription for some cough medicine, number one, it's not going to have narcotic in it, because that is now against all studies that have been done recently. You're not getting a narcotic for your child. No, we don't do that whole, what was that crap? Oh, codeine cough syrup. That's not a thing anymore. We don't give that to kids. It's bad for them. Okay? So don't come in and expect it, because you're not going to get it. But we might give you Bromfed, which is a great cough medicine, don't get me wrong, but it's also like $50 a bottle. And I don't have $50 to throw away on some cough medicine when I can just go buy Mucinex. Okay? But for little kids, what you're going to want to, you know what you buy? Benadryl. You buy Benadryl. You know why? Because it dries up the nasal secretions. Dry up the nasal secretions. You stop the postnasal drip. You stop the cough. Okay? So just try that first. The thing is, you got to try stuff before you come to the doctor, because we're just going to ask you 1,000,001 questions about what did you try so far. And if you tell us nothing, then we're just going to make you go try that stuff. So try that stuff beforehand, and then you'll get somewhere, okay? So we talk about that. Okay, sore throat. Do you know how many people have come in to our office because their kid complained of sore throat for one day? Too many to count. Too many to count. Do not come in on the first day. Okay? Don't do it. Don't come in on the first day. There's literally nothing to even test on the first day. So say your kid has a sore throat, a cough, a runny nose, and maybe a fever. Like maybe they're like 101. Do they have strep throat? Probably not. You know why? Strep throat only causes the sore throat and fever. Usually does not get accompanied by runny nose and cough. Now, can you get a cold first and then a week later, because your immune system is already fighting something, can you get strep? Of course you can. And if that's the case, then fine. But if they start out with everything at the same time, it's probably not that. If your kid has a headache and a sore throat, vomiting, big one, like nausea, I don't know why little kids get that, but when they get strep throat, they get some gnarly bellies. But really, I mean, sore throat and fever. If your kid has sore throat and fever and it's been going on for 3 days, then you go to the doctor. Whether it's strep or not, you go to the doctor just to make sure things are okay. Fever for 3 days, it won't go away. And you know, nothing's getting better and nothing's getting worse. Go to the doctor. You know, if your kid's been complaining that their ear hurts for 3 days and they have a fever, please go to the doctor. They probably have an ear infection. But again, what they're telling us to do in school, meaning medical training, they're telling us you do not give an antibiotic unless this child has been running fever and had ear pain for 3 days. So why would you go in before day 3? Because you're just wasting your time. The doctor is not going to give you anything. I mean, I'm just trying to save everybody time, trying to save everybody money, because God knows I cannot afford to be taking my kid when my freaking copay is $40 a freaking time. Like, insurance. Whatever. Anyway, so there's a deal. I always tell my parents, though, I'm like, look, if your mama bear alarm goes off, everybody has that thing. Like once you have kids, it's like you get this sixth sense. You know that if your kids are quiet, they're probably doing something bad and you need to go find them. And you know when your kid's legitimately sick. Okay, because kids will try to fake you out. Even little kids. I mean, Char's 4 and she still tries to play me. She's like, oh, my belly hurts today, as she eats a cinnamon roll. Kid, come on. But if your mommy radar or daddy radar is going off, there's something wrong with your kid, please take them. Please take them to the doctor. If it is not emergent, people, emergencies go to the ER. So emergencies are what? Let's think about it. Head injuries where they've lost consciousness or are having seizures. A limb, an appendage is hanging off. Something is bleeding profusely and it cannot stop. Someone is vomiting and they cannot stop. Someone has blood coming out of their butt or out of their mouth, like vomit. They're vomiting blood. Please take those things to the ER. If your kid is screaming in pain and grabbing their stomach and they haven't eaten in 3 days, you might want to take them to the ER. Coughs, colds, sore throats, those are not reasons to go to the ER. There are people who are way sicker than that, waiting for an hour to be seen. Don't make those people wait longer because you want to get some cough medicine for your kid. Don't do that. And look, I'm not trying to offend anybody, but we have got, healthcare costs are through the roof. We're going to start, doctors cannot keep providers cannot keep operating in the way that we are. We can't be made to see a patient in 4 to 7 minutes, regardless of the reason. We cannot do that. So if we're going to have better health care, we need to start really thinking about, this is an emergency, this is not. This can go to my primary care doctor, this cannot. Okay? Just be respectful, be mindful of what you're doing. If your primary care doctor is not open, then you go to the urgent care. You don't go to the emergency room. The emergency room, no. Now, If my 9-month-old baby woke up with a 104 fever and was crying and I couldn't get them to stop, yes, I would go to the ER. I don't care if her nose is running or not. Of course I would take her. But that's not the case most of the time. Okay? So just be respectful, because ER doctors are under a lot of stress. They get burnout, and they surely do not need somebody coming in and harassing them about getting an antibiotic for their kid who has a cold. Okay? We need to be real about this. Your kid does not need an antibiotic if they have a cold, just like an adult doesn't need one. If you man up, don't get the man flu, because guess what? The man flu, you don't get any medicine either, and you don't get any sympathy in this house. But anyway, MisAdventure Mama has straight up delivered a knowledge bomb today. Again, I hope that I haven't offended anybody, but bomb has been dropped.